Have you ever felt anxious before taking a test? Have you ever felt your heart beating rapidly when stepping to the batter's box, up to the serving line, or the moment before the quarterback calls hike? What about when watching a scary movie and you know something's going to jump out at you? You most likely have experienced anxiety at some point in your life. It's common and nothing to be ashamed of. So, my name is Sarah Medikevich, and today's workshop will be about anxiety and exercise. Can you think of a time when you felt your heart racing and your palms started getting sweaty? Well, with today's workshop, I will be teaching you what anxiety is, how does anxiety affect our daily lives, and how can exercise help you cope with anxiety. So for our audience, this can be useful to students, athletes, adults, senior citizens. It can be helpful to doctors, therapists, and so on and so forth. So now you might be wondering, what is anxiety? Anxiety is a set of behavioral manifestations and can be divided into state anxiety and trait anxiety. State anxiety is temporary episodes or feelings of anxiety. Trait anxiety is chronic and persistent episodes or feelings of anxiety and becomes a personality trait. When one has anxiety, they tend to feel tension, apprehension, nervousness, worry, and increased activity of the autonomic nervous system, according to a study by Kamino et al. Overall, anxiety is very common, meaning just about everyone experiences it in certain situations. So there are different types of anxiety disorders currently, and it can be diagnosed by a professional using the DSM-V, which is the Diagnostic and Statistical Manual of Mental Disorders, 5th edition. So the types vary from panic disorders to certain phobias and PTSD. Each of the disorders come with their own symptoms, and it is common for patients to be diagnosed with more than one disorder, according to a study by Bystrisky et al. Patients with anxiety disorders usually go untreated and are the most prevalent mental health conditions. So there are different types of anxiety and anxiety disorders, and a few common disorders are generalized anxiety disorder, known as GAD, obsessive compulsive disorder, which is OCD, and post-traumatic stress disorder, which is PTSD. GAD is when patients suffer from somatic anxiety symptoms. They tend to experience muscle tension, palpitations, and tremor with persistent worrying about anything that comes to mind. OCD is chronic and repetitive, uncontrollable thoughts. PTSD is a condition that's triggered by a traumatic event. Soldiers tend to experience PTSD when they have flashbacks and nightmares from war. These are just a few anxiety disorders that affect many people, according to a study by Bandelow. So what is the difference between trait and state anxiety? So for our next objective, how does anxiety affect our daily lives? Not everyone will portray the symptoms of anxiety or even be diagnosed with it, but according to a study by Bystrisky et al., 13.3% of people have an anxiety disorder across the U.S. They also seem to be the most prevalent subgroup of mental disorders. So that 13.3% is still a decent chunk of the population that suffers from anxiety disorders. Certain types will affect lives of those in certain ways. For example, as I mentioned earlier, PTSD is having flashbacks or nightmares triggered by a traumatic event, and OCD is having obsessive, persistent, uncontrollable thoughts. So anxiety disorders usually have a negative effect on the body and especially on the mind. There are psychological factors that come into play, such as the feelings of worriness, stress, and fear. According to a study by Bystrisky et al., in most anxiety disorders, patients usually process fear-inducing information in excessive detail that overwhelms their ability to appraise it properly. Therefore, they usually expect the worst out of a situation. This also makes for their cognitive functioning to be impaired. Patients won't be able to think properly, hence decreasing their ability of decision making because they always assume the worst outcome. So there's more to anxiety than just psychological factors. Anxiety can affect the body physically, such as decreased productivity, increased morbidity and mortality rates, and increased drug and alcohol abuse. A patient can expect physical health problems if they do experience chronic anxiety and don't do anything about it or contain the issue. Cardiovascular disease especially is one health problem that can come about the patients if they aren't getting proper treatment. Having the feelings of apprehension or fear will put stress on the heart and the body. If a patient's anxiety doesn't get put under control, it could be too late for them. So, what are some psychological factors that play a role in anxiety? So, for the last main idea, last objective, how can exercise help you cope with anxiety? Although there are different ways to cope with anxiety, exercise is one of the best ways. Exercise has the possibility of symbolizing a promising, affordable, and easily accessible option for patients, according to a study by Stonerock et al. Physical activity has shown to decrease the risk of being diagnosed with an anxiety disorder. In order to see improvement, patients must exercise regularly. It may be hard for a person with anxiety to engage in physical activity, but as long as there's a structured plan that is fit for them, then that should help with their diagnosis. So, being physically active helps take your mind off of things. Too high of an intensity can put even more anxiety or stress on a person who already suffers from anxiety. That's why it's important to make goals of improving one's fitness level and making sure the intensity is just right. As long as that person is going the speed and intensity that is comfortable for them, they should start seeing progress in overall physical and mental health. Aerobic exercise was the most common type of exercise used amongst those with anxiety and led to stress reduction by a study according to Stonerock et al. It all really depends on what kind of exercise the people want to do, whatever will help them get through their anxiety. So even though I've been discussing what exercise can do for the body when having anxious episodes, there are various ways to cope or treat anxiety. Physical activity won't always be the best option. It just varies from person to person. But some other options are psychotherapy, medication, and phytotherapy, which are certain treatments that can be implemented, according to a study by Bandelow. So, what are other ways to treat anxiety besides exercise? So how can you apply this material that I just taught you? If you are a doctor, you can use this information on your patients if they're experiencing anxiety and also need to be a little bit more educated on it. This can also help them know what to do to help their anxiety. You can also use this information on yourself if you're experiencing anxiety as well. So, what's another way you can apply this concept to yourself or someone else? So, in conclusion, overall, there are different types of anxiety disorders. Anxiety is very common and can happen to just about anyone. It usually is diagnosed by a manual used by professionals. Also, anxiety can affect the lives of those in different ways, such as decreased productivity, drug and alcohol abuse, and increased morbidity and mortality rates. It also tends to disrupt cognitive functioning as well. There are different ways to cope with anxiety, such as exercise being one of the best ways to do so because it decreases the likelihood of being diagnosed with a disorder. The person suffering shouldn't pick an intensity too high or too difficult because it may increase their anxiety levels. So you can use this information on patients of your own that are struggling with their anxiety and need to be educated on it, and you can use this information for your own sake if you're experiencing an anxiety disorder. So last question. What are some key points you can take away from this? What will you do with this information when you leave? And these are my sources that I used.